All right, so this is part 2 of our respiratory system lecture. This is beginning with whooping cough. It's caused by a bacteria called Bordetella pertussis. This bacteria you inhale through droplets, and then when the bacteria gets into your respiratory system, it will attach to the ciliated cells of your airway, and it produces toxins. And those toxins, you can see here, are going to destroy those ciliated cells. So TCT is a toxin called tracheal cytotoxin. The bacteria multiplies, then comes your neutrophils, and then we have inflammation is starting, damage to the ciliated epithelium, and LPS, Bordetella, is a gram-negative bacteria. And that toxin makes mucus hypersecretion. So we're producing a lot of mucus. We have our white blood cells coming in. So we're creating a lot of basically exudate. We're causing a lot of fluid to build up in these areas, and our cilia are damaged. So this mucociliary escalator is not going to function. And so what that does is it causes the person to cough, because when you cough, you kind of like, it's a way to move mucus up into the back of your throat. So when you cough, it's doing the job of your mucociliary escalator. So you can see that there's many, white blood cells that come to fight the infection. You don't need to know these, but you should know the pathway that it does create a toxin and it destroys those ciliated cells. So if we go to the next one, you can see that there's 3 stages. The first stage is relatively mild. So a lot of parents, this is a disease that you see in kids a lot. There is a vaccine for this, right? The DTaP vaccine. So either your vaccination wanes or you're not vaccinated yet. So the very, very young babies that don't get the vaccine yet, or they're not totally vaccinated, are susceptible to this. So parents don't know that it's Bordetella because it's just like anything else: a runny nose, sneezing, low-grade fever, nasal congestion. This is when it's the most infectious because you have that live bacteria colonizing and multiplying. The next stage is where you have the results from the mucus and the cilia being damaged. So that's going to cause an uncontrollable cough. These spasms of coughing can last for several minutes, and so basically violent that they can cause vomiting to occur. And this can last for several weeks. It's very, very scary. I'll play the video of a small infant with whooping cough.
It's just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a bath there, honey. Come on. Almost there. There we go. Oh, it's okay. It's okay. Yeah.
Okay, I'm going to stop it because it's pretty disturbing. I would be really freaked out if my child was doing that. So that's our paroxysmal stage. The last stage, called the convalescent stage, can take a chronic form. So patients can have a chronic cough that lasts for several months. The disease is sometimes called the 100-day cough because of this last stage here. And you can see that infants under 1 are most susceptible and have the most severe symptoms because they lack any protection against that. And they're very young mucociliary escalator. Let me go ahead and so the DTaP vaccine, the AP stands for acellular pertussis. Acellular tells you that the vaccine is a part of the cell, right? So it's not the whole bacteria, it's just an antigenic portion of that bacteria. And we know that those kinds of vaccines they're not very efficacious. They need to have boosters. So here is a graph of just reported pertussis from 1990 to 2021. So you can see that overall it's come down, but there was a spike in it in this, between 210 and 215. And they think the spike was caused by just people not getting that booster shot. Here is the vaccine, and you see that everybody should get a booster shot every 10 years of this vaccine. So if you don't know your current status on this vaccine, maybe go check your records, because once that wanes, right, then you're susceptible to getting whooping cough. All right, so wrapping up here, this is the bacterial infections of the respiratory tract. We talked about otitis media. We talked about diphtheria. We talked about pertussis. We talked about streptococcus pharyngitis and scarlet fever and tuberculosis. Here, we talked about our Haemophilus pneumonia. We talked about our walking pneumonia and pneumococcal pneumonia. There are, lots of diseases I don't cover. Unfortunately, there's just so much material. I'm choosing what you might see the most. So I hope that's okay with you. All right, so now we're going to start the viral infections of the respiratory tract. We have a lot to cover, so we'll begin with the cold. All right, so the common cold is really just a moniker for these mild respiratory illnesses. There's many different viruses that cause a cold. The three most prevalent viruses that cause colds are called rhinoviruses, coronaviruses, and adenoviruses. The picture here has a rhino holding a corona, so the rhinovirus and coronavirus are two that you can remember that way. And adeno, I don't know, and then you add some NyQuil to that. It's transmitted via droplets, as we know, fomites, hands to mucous membranes, and and I put fomites again, but washing your hands and making sure you don't touch your eyes or nose or mouth with your hands that might have a virus on it is the primary way to stop colds. We're infecting the lining of our nasal passage, so this is going to be higher up in the respiratory tract. So colds are basically in the nose. Viruses that like to replicate the cold viruses like the cooler area of the nasal cavity because you're breathing in the ambient air. And although other animals can actually catch a cold, there's never been an interspecies infection. And only one rhinovirus can cause a cold. So you can see the virus particles in this guy's nasal cavity. So it's basically an irritation of the mucosa that leads to an inflammatory response in the nose. And you guys know the common symptoms of a cold. The one sort of thing that is generally used is that colds don't have a fever typically associated with them, but other viral infections like the flu do have fever. Many viruses are related that cause the cold, so you can get immunity throughout your life. However, because there's 200 of them, you never really gain complete immunity to the common cold. In this guy here, an untreated cold will run its course in about a week, whereas with treatment, it will take 7 days. Yeah, this is pretty true. You can do the cold treatments, the vitamin C, but it's really just shortens it by very little time. So this is a nice comparison between cold and flu. The cold is, the fevers are low in cold, high in the flu. Headaches are common for both. Aches and pains, more severe the flu. Fatigue is very severe in the flu. Nasal congestion and sneezing is pretty rare with the flu, but common in a cold. So lots of blowing your nose and sneezing. All right, so the flu. The flu is caused by the orthomyxovirus, and the flu, where you find it, is basically aquatic birds. So in birds, we have flu viruses that are part of their gut. Ducks, swans, etc. Pigs, horses, and humans also can carry the flu virus. Transmission, of course, is person to person, droplets and aerosols. However, how birds get it to other birds is through their droppings. So birds don't cough, but the virus is found in their feces. So when birds fly, they will produce droppings. The droppings come down and travel in the air, and they can, basically travel to pigs, horses, and humans in that way. So they can spread the flu while they're flying. And so the flu primarily affects the upper respiratory tract, But with the flu, depending on how virulent the strain is, it could cause pneumonia. So it can go deeper into the lung. It's very pervasive worldwide. There's deaths that are caused by the flu every year. So it is a serious illness. It can be a very serious illness. There is a complication of flu, Reye syndrome, which is a complication of other things as well. But Reye syndrome is where you have swelling in the liver and the brain, and you can become damaged neurologically, go into a coma, or you can die from Reye syndrome. So this is just a sort of a flow chart for you to follow, right? With influenza A or B. So there's different categories of the flu, A and B and C, D, so on. But A and B are the most common kinds to cause flu syndromes, or like the Reye syndrome, but also just the flu, like a nasty case of the flu. A is the most virulent form. Another thing that can cause Reye syndrome actually is taking aspirin. So you don't want to give kids aspirin. But after you recover, what Reye syndrome is basically inflammation of the liver and inflammation of the brain. So that's both very dangerous. So the flu has a couple of spikes on the surface. So it's an enveloped virus. Inside is RNA. Okay, so it's an RNA enveloped virus, and it has an H spike and an N spike. The H spike is for hemagglutinin, and it basically is used for attachment. All right, so the H spike gets it attached to your cells of the respiratory tract, and the other spike, the neuraminidase, is going to assist the virus from getting out, assisting the release of the virus. So both of these are really important for the virus's replication. H gets them in, and N gets them out. So depending on the shape of these H and N spikes, they are named after them, right? So there's 15 different H spikes that we know of, 9 different N spikes. And on the virus itself, right, we have lots of H spikes and about 100 N spikes. So for example, H5N1 or H1N1, now you know what the H and the N stand for. It's the type of virus, like what kind of spikes do they have. So the spikes, the H spike, that's the one that gets you in. There's regions that are recognized by the immune system. These regions on the H spike are what we attack with our antibodies and our immune system. However, this region does mutate quite rapidly. The H spike has another region that's necessary for infecting the cells, and that part remains constant, which is basically a way of like, this H spike is really sneaky. The part of it that gets you into the cells never changes. So it always is going to match some kind of receptor on the cell surface. And then the part where your immune system actually can get to does change. So that mutation can cause your antibodies to not fit that same H spike due to those like small mutations. So those really small mutations I'm talking about, those minor changes, is called, that changes in every flu season, is called antigenic drift. Just this, it's an area, it just causes your antibodies to bind less tightly. So this is an example, right? The H3 spike has a base pair mutation, one amino acid changed. It's still the H3 spike, but slightly different. So the antibodies will not bind as tightly. And then if you don't bind tightly, you're going to less immune response. There's a very high mutation rate in the flu. This is very characteristic of all RNA viruses, because if you're an RNA virus, you use RNA polymerase to make more RNA strands, and RNA polymerase does not proofread. If you remember from the genetics, DNA polymerase does proofread. So if you're a DNA virus, you're less likely to mutate, because there's that enzyme that when you're copying the DNA, it actually can detect a mistake and then fix it. But this enzyme does not. It just leaves those mistakes in. So those mistakes end up being these mutations. Okay. So this is an image of antigenic drift, where we have the virus, and we have, this would represent the H spike, right? So we have circle, triangle, square. Here's our antibody made to the virus, and that really tight binding of the antibody to the virus. So this is a good immune response. If that little guy mutates slightly, now we have circle, circle, square, we see that the antibody that we made during the first infection doesn't really fit that well the second time around. And this time, you're going to get less of an immune response. So this is why the flu shot changes every year, because of the antigenic drift that's occurring in the world. And they try to find the strains that are going to be most prevalent in the world to put in the flu shot. Major changes are called antigenic shifts. So if you completely switch the H, let's say, right, there are, I was just looking at the numbers, there's 15 different H spikes. So what if a flu virus that's been around, right, let's say it's H1, all of a sudden changes to an H2. How did that happen, right? This is a really big change from an entirely new H spike. So those shifts are due to this thing called genetic recombination. And basically what happens is you have to get 2 different flu viruses infecting one cell. The virus's genome is 8 strands of RNA. So 8 separate, 1, 2, 3, right? It's all this. So there's 8 of them, 1, 2, 3, 4, 5, 6, 7, 8. Those guys, if you're infected with another flu virus, like a different strain, right? It's also going to have 8 of these linear strands of RNA. You can see that if these guys are in the same cell, it might be kind of easy just to like package up, you know, a viral RNA strand from one virus. And then now you're going to have a virus with a new DNA makeup, and that can cause that shift in the H. Okay, so what kinds of cells are going to be able to be infected by 2 different strains of flu virus? They're called mixing vessels, and pigs are known to be mixing vessels. They can be infected with 2 types of viruses, or a person can be a mixing vessel. Birds, they spread. If there's genetic recombination occurring in a bird, then they are able to spread it, right? It's not going to be contained to just like one person or the person who contacted the pig. If you have these big shifts in a bird, then they can spread it over long distances when they migrate, the flu being in their droppings, and that can spread it to other animals. The shifts here are allow the viruses to completely evade our immune system, because our immune system, back to this picture, this is the same H spike, right? So this is like, let's say this is H5, right? We were infected with the flu last year. We get the flu this year, or we get infected with the same H5 spike. It mutated slightly. Maybe we're protected, right? Maybe that antibodies will fit enough to cause a nice immune response, or maybe it doesn't fit and we have a small immune response. We still feel like we got sick. So it's variable what happens here, but it's still the H spike. So you still have some kind of recognition to that spike if you got the flu or if you're getting the flu shot, right? What happens in a shift is that H5 becomes an H1, or it becomes an H2. So it's a completely new one, and our bodies have never recognized that H spike before. So everybody's going to be susceptible to getting the flu when there's a new spike. So what happens in a spike, in this antigenic shift, it causes pandemics. If there's a brand new flu strain going around, nobody has immunity to it, or even partial immunity to it, and the population, so that's what I said, population has no immunity to a brand new H spike. So here's an image of a mixing, right? So we have virus 1, virus 2. They are going to empty their RNA into the cell, and the cell, as it packages up the RNA, right, as the new viruses are being budded, they're going to include a mix of those RNAs between the two, and then a brand new strain can come out. So here's flu virus 3. These shifts tend to be cyclical every 10 years. So if you hear people talk about like we're due for a flu pandemic, this is because the timing of it. However, we do have more of a widespread program to give people flu shots. It's available at your drugstores now, right? Anybody can go in and get a flu shot. So that's probably going to drive down the shift, hopefully, but you never know. So here's our antigenic shift, and this is a picture of our mixing vessel, the pig. So we have a person with H1N1, a bird has H5N3, pops out H5, which is from the bird, N1 from the person. So that is a shift. So you can see that influenza A is the most pathogenic. The severity of the disease is severe. versus moderate versus mild. Animal reservoirs, yes. So influenza A is the one we find in birds and in the pigs and horses that we talked about. There's the genome segments, the population spread, pandemic, and epidemic. For B, it's epidemic. It's not as severe. And then the C is sporadic. For the variation of the antigens, we can have antigenic shifts and drifts, whereas these basically have drifts. So influenza type A is the one that people worry about, and this is the one that we're going to get vaccinated against. So before COVID, when I lectured, nobody really experienced what a pandemic felt like, and now we do know what a pandemic feels like. So this picture might not be as shocking, but this is a picture from the 1918 flu pandemic. It lasted till 1919. And people worldwide had the flu, and it killed 40 million to 50 million people. That is a lot of people. Really wild to think about that happening. The one strain that is highly pathogenic with birds is called H5N1. It's also called the bird flu or avian flu. And this is the one that's driving up the egg costs because the chickens that lay eggs, if they get this strain of flu, it will kill almost all of them. So in order to protect, more chickens from getting infected, they killed a lot of chickens just hoping not to spread the flu virus. H5N1 is a particularly nasty strain because instead of the receptors higher up in the respiratory tract, they like to hang out and attach to the alveoli. We know that's really dangerous because of pneumonia. So deep in the lungs, it can be very deadly. And this is basically how people die from flu, is mainly through the pneumonia. It also causes a wide-ranging inflammatory cascade for your, it's basically a super antigen, leads to a lot of cytokines, and so that's mentioned here, right? So it just causes this overreaction of the immune system, which can cause, we talked about the cytokine storm. It can cause shock, lots of nasty things from this. But that is how this strain is particularly virulent. This is how many viruses are spread to humans. So it's basically human-animal contact. So if any one of these chickens had the avian flu, it could jump to the human. So here's what I'm going to say. These birds will all have some kind of flu virus, right? Whether that flu virus can infect a human is going to be due to a mutation. So all these viruses that infect the chickens have those attachment sites to chicken cells. And the chicken cells are not the respiratory cells. So in order for the bird flu that's in the bird to be able to infect a human, that's going to have to be a mutation where the H spike is able to recognize a human cell and get into a human cell. So that is always the question. We can't really plan or know when that's going to happen because it's, as we know, mutations are spontaneous. But that is the jump to human. So it's not automatic that a human is going to get the flu from a bird. The virus has to be, the spikes on the virus have to be able to match the human cell. So here's our flu shot, 3 to 4 viral strains. The data is pooled from around the world, the CDC, in places in Moscow and in other countries will come together and they'll decide what they should put into the flu shot. So there's 3 to 4 viral strains that you're protected from. And like anything else, it's a guesswork, sort of not anything else, but it is a little bit of guesswork, right? You get the data, you're going to project what you might see in the next flu season, and you're going to choose your viral strains. And you're choosing your viral strains months out because you need time to make the vaccine. So sometimes the viral strains are right on. You might hear that in the news. Oh, the flu shot is doing well. And sometimes those strains are going to be a little off. And so the flu shot might not be as protective as you thought. What kind of vaccine? So the flu shot you're getting is an inactivated whole agent. So the whole virus, but it's killed. And then the flu mist is live attenuated. The flu mist is the best protection against the flu because it's going to mimic the infection without the illness, obviously. However, you don't want to give a live virus to anybody who's immunocompromised because you don't know if the virus can back mutate and then the person's immune system would not be able to get rid of it. Our next virus is going to be coronavirus. We're familiar with COVID-19, but these are two other ones that are in the coronavirus family. SARS. So SARS stands for Severe Acute Respiratory Syndrome. This is considered an emerging disease passed by droplets. This was identified in China, and it causes pneumonia and respiratory distress. 10% cases of fatality is very high. SARS is related to another virus called MERS, and the symptoms are very similar: high fever, headache, body aches, and most patients will develop pneumonia. So there's three major pandemic coronaviruses, as we know. So MERS, SARS, and COVID-19. They are all coronaviruses. So the MERS stands for Middle East Respiratory Syndrome. And it was Middle East because it was first reported in Saudi Arabia. And it has a very, very high fatality rate, very high. For these two, they're severe acute respiratory syndrome related viruses. So we're very familiar with COVID-19, and it had a fatality rate of about 1%, whereas SARS is 10 times more virulent and can kill 10%. So all these viruses are serious infections of the respiratory system and can lead to death. The next one on the list is measles. So let's start with measles. Measles are found in humans. So measles virus, MEV, is what the virus is called. Very, very contagious. Right now, measles is having a little bit of a moment because of the unvaccinated people that are contracting the virus. So when something is highly contagious, contagious in itself means it's easily passed from person to person. So highly contagious is just very easy to catch measles. Transmission can be direct contact. You're inhaling the secretions or droplets. And the droplets for measles is, the measles virus is tiny, tiny, so it can stay hovering in the air. So if a person with measles comes into a room, coughs, leaves the room, someone comes in a few minutes later, half an hour later, they can actually contract the measles virus because it's still hovering in the air. So for measles, initially, we're going to have fever, conjunctivitis, sore throat, and then once it goes into the bloodstream, it'll cause a rash, and that's where the Koplik spots are called. In the inner, and they're also on the inner lining of your mouth, your cheeks. So measles was a disease that was sort of like everybody got it. You know, sometimes people have measles parties where like they just take their kid over, get measles, and just get it over with. It's usually self-limiting, but there's always that chance that it can lead to pneumonia, which is deadly, encephalitis, which is infection of the brain, and then death. So it's not gone, right? It's still present. There are more than 145,000 measles deaths in the world in 2013. There's no effective treatment for measles, so the best way to prevent getting measles is through the vaccine, and that's going to be the MMR, okay? Measles, mumps, and rubella. This is interesting. So the MMR vaccine reduced to 200 cases of measles in the United States a year. However, this outbreak we're having now in May, as of May 8th, 2025, 1,001. So we went from 200 to 1,001. So that's how quickly the measles can spread. So this is the images of the signs of measles. So this is the rash. These are called Koplik spots. And then inside the gums and the cheeks, you'll also have the red rash. So that's another sign of measles. All right, so we're going to take, we'll talk about German measles and we'll take a break. So German measles is caused by a different virus. It's caused by a rubella virus. So it has no relation at all to the other measles we just talked about. This kind of measles is mild. It does cause a rash. So if you look at the rash, you can see why rubella is called German measles, because the measles causes this rash and they look identical or very, very similar. However, this virus is not as deadly as the measles is. So it's transmitted from person to person. Half of people who get infected are asymptomatic, so it's not very virulent. However, the problem arises with pregnant women. So MMR really is to protect against women who may be pregnant and have this, because it is teratogenic. What that means is that it can pass through the placenta while the baby's developing and cause really bad developmental defects while the baby's developing. So there's a lot of stillbirths that can occur, spontaneous abortions, and then congenital birth defects. Here we have congenital rubella cataracts. It looks like keratitis, right? It looks like the gray area that's caused by degrading the cornea. However, cataracts is the lens. So you have a lens inside your eye, and that is what it's affecting here. So MMR vaccine has eliminated rubella in the United States. There's a handful of cases a year. And here's another look at the rash that is from German measles. All right, we're going to pause there.